Ebola. Just hearing the name is enough to make people panic. But how much of what we know about Ebola is actually true? And how much is fear, rumors, and misinformation? As concerns grow across Africa and debates continue online, many Kenyans are asking the same questions. Can Ebola spread through the air? Can it be stopped? And should Kenyans be worried? Today on Bruze Uncovered, we separate facts from fear. Ebola is one of the deadliest diseases ever discovered. The virus was first identified in 1976 near the Ebola River in what is now the Democratic Republic of Congo. Since then, several outbreaks have occurred across Africa, claiming lives of thousands. But despite how dangerous Ebola is, misinformation often causes even more panic. One common myth is that Ebola spreads like flu through the air. That is false. According to health experts, Ebola spreads through direct contact with bodily fluids from an infected person or contaminated materials.
Now, one thing people should understand, Ebola is not airborne like a cold or a flu. You're not casually catching this from walking past someone in the grocery store or sitting next to them for a few minutes.
This means touching infected blood, vomit, sweat, saliva, or other body fluids can expose someone to the virus. While there is no simple cure, early detection, supportive treatment, and vaccines have significantly improved survival rates in recent years. So why do Ebola outbreaks cause so much fear? Because the disease can spread rapidly when health systems are overwhelmed and when people fail to report symptoms early. The symptoms often begin with fever, weakness, headaches, and muscle pain before becoming even more severe. Health officials worldwide stress that awareness and prevention remain the strongest weapons against Ebola. And that brings us to Kenya. Whenever reports emerge about Ebola patients, outbreaks in neighboring countries, or international health discussions, social media quickly fills with rumors. Some claim the country is in immediate danger. Others dismiss the threat entirely. But experts say that neither panic nor ignorance is the answer. The best response is accurate information, vigilance, and trust in public health systems.
The outbreak is moving fast, and we're still playing catch up. But my trip to the DRC also gave me real hope that together, under the government's leadership, we can bring this outbreak under control. The only way we will do that is through government leadership, community ownership, and close partnership between the many actors on the ground.
The lesson from every Ebola outbreak is simple. Facts save lives, fear does not. What do you think? Do you believe misinformation has become as dangerous as the virus itself? Let me know what you think in the comments. I'm Bruce, and this is Bruze Uncovered.